Bismillahirrahmanirrahim. Assalamu alaikum. Here it's me, Faryal Hussain, studying at PUMHS University as a first-year MBBS student. Firstly, I would like to thank all the ambassadors of eye healthcare for arranging such an effective and creative work for the student during this pandemic. I would like to thank you, all of you as well, for being here. Kindly like this video and subscribe the channel. So my presentation topic is glaucoma, also known as kala motia. Glaucoma is basically a group of eye disease which eventually can lead to the irreversible blindness. Means the person with glaucoma won't ever get its vision back once he or she lost it. Glaucoma is the second most common cause of blindness all over the world. Indeed, it's really a dangerous disease. WHO once estimated that the patients of glaucoma most probably are expected to rise up to 111 million by 2040. These days, 3 million people are suffering from glaucoma alone in America. That's why it's really important for us to at least be aware of this disease. Let's talk about its cause. Cause of glaucoma is simply an intraocular hypertension, which means increase in the pressure inside the eyes. Intraocular pressure should be from 8 mm to 22 mm of mercury, which is important in maintaining the shape and the tone of the eyes. Increase in the intraocular pressure slowly and gradually damages the optic nerve. Optic nerve is a nerve which is responsible for our vision. It actually receives the light-generated nerve impulse from retina and transmits this to the brain, where we can recognize those electrical signals as a vision. And if somehow optic nerve is itself damaged, we won't be able to see any of the object and to get any signal. So firstly, a patient of glaucoma will lose its peripheral vision. Holes of light will form in front of its eye, and if it's left untreated, a person will become completely blind. Looking at the broader view, our eye is made up of 3 chambers: anterior chamber, posterior chamber, and the vitreous chamber. If we talk about anterior chamber, it is the space between cornea and the iris. Posterior chamber is a narrow space between iris and the lens. Vitreous chamber is the space between the lens and the back of the eye. Let's have a look at anterior chamber. It contains aqueous humor, which is a transparent watery fluid secreted by ciliary bodies. It provides nutrition, structural support, and maintain the pressure and the shape of the eye. We all should be aware by the fact that our eye is producing and secreting watery substance 24/7 continuously, and this balance of production and secretion should be maintained. Otherwise, a pressure will develop within the eye, and this will damage our optic nerve, and we won't be able to see any of the object in front of our eye. This high pressure not only damages the optic nerve but also affects all the parts of the eye. So aqueous humor is a secretion by ciliary bodies in the posterior chamber, then flows through the pupil and leaves the eye. Fluid normally drains out through a tiny drainage channel called trabecular meshwork. In glaucoma, that aqueous humor drainage pathway becomes partially or completely blocked, so that the fluid can't easily drain out. This causes pressure within the fixed space of the anterior chamber, and our eye won't be able to receive any of the visual signals. This abnormal increase in the pressure will slowly and gradually damages the optic nerve, and as a result, a patient of glaucoma will lose its peripheral vision, and if it is left untreated, the patient will lose its central vision as well and become completely blind. Let's talk about the symptoms of glaucoma. Unfortunately, a person having glaucoma won't even realize that they have it because it shows no early symptoms. However, eventually it shows some signs like eye pain, redness in the eye, blurry vision, severe headache, nausea, and visual holes. Firstly, to be safe from this disease, we should go to our ophthalmologist weekly, because several painless tests that determine the intraocular pressure and the status of the optic nerve and the drainage angle prevent further loss of the vision. Treating glaucoma actually won't bring back any vision you lost. but it can help to save the sight you still have. So let's just talk about its treatment. We can treat glaucoma by just lowering the intraocular pressure, decrease the production of aqueous humor, or increase in the outflow of aqueous humor. So during its start, ophthalmologists will suggest some medications or eye drops, or eventually laser treatment is also really effective, or at last it is the only option left, that is surgery of our eye. So that's it. I tried my best to deliver a little information about glaucoma. I hope you people like it. So kindly like this video as well. I will be very grateful for you all. Thank you so much.